in a group of people who are endocrinologists and physicians. But yes, we would talk about surgery for diabetes. But yes, you made my presentation a little bit more easier. So talking about surgery for diabetes, a lot of things to talk about. So for you all, I think the facts are very clear. But for other physicians and other colleagues of mine, there are some facts which need to be understood. India is deemed as the world's capital of diabetes. It's the ninth leading cause of death globally. Type 2 diabetes is caused by overweight and obesity about 90% of the time. 2019 showed that 77 million individuals had diabetes in India, which is expected to rise to over 134 million by 2040. Now, it's important here to understand that approximately 57% of these individuals remain undiagnosed. So there are a few challenges. I would like to mention about the challenges which we have seen because of diabetes, which is a progressive disease in nature. Therapeutic burnout. That's the reason we are waiting for newer medication, newer molecules. Definitely there is some micro and macrovascular complications. Even when the sugars are controlled, these patients do have these complications. Poor compliance. Patients do not stick to the insulin therapy. Maybe they have some financial burdens and wait even years with insulin and sulfonylureas. GLP-1, which is talking about Rybelsus. There are GI side effects also. There are something to counteract that as well. But yes, there are GI side effects. Now there are patients who are reluctant to start with insulin and access to the newer and more effective drugs. I mean, India is so desperately waiting for Mounjaro and for semaglutide to come. So in our part of the city or our part of the country, there is still not possible. So there are challenges with medical management, the role of surgery in diabetes management. So I would see a lot of IPOs coming after the slide. Diabetes surgery is the most effective treatment for type 2 diabetes and may result in remission. That is, being able to stop medications, all the medications, or improvement in nearly all the cases who undergo bariatric surgery. It is the single most effective way to resolve condition and stop the need for medication. Diabetes surgery performed today has been highly refined over the 70 years and among the best studied therapies in modern medicine. Let's digest this for the moment and just go ahead. So what exactly we are talking about? Bariatric and metabolic surgeries. What you see here is a sleeve wherein the patient's cut part of the stomach is seen on the kidney tray. It's actually taken around a liter of normal saline to inflate that much of stomach, and what part is left behind is only 70 to 120 ml of the stomach. What are we trying to achieve by doing this? Is giving a restriction to the patient's appetite, and that's why Ghrelin, which I will be talking in detail later on, would go down. Second is the Roux-en-Y gastric bypass, by far the gold standard for diabetes remission and reversal. Here, the stomach size, what you see is only 25 to 30 ml. It's very scary to even understand that, but when you see the mechanism and how the weight loss is going to happen, that by far becomes a very good surgery for diabetes reversal. This is Roux-en-Y gastric bypass. Third is the one anastomosis gastric bypass, wherein this is the stomach pouch, which you see it in this picture. It is the patient picture, and that's how the stomach pouch is around 70 to 80 ml. That is, the food intake is only 70 to 80 ml. And we calculate the amount of small intestine or the initial bowel which is to be bypassed based on the patient's BMI, based on the patient's diabetic profile, and that's how we do a bypass. Now, why these surgeries? What exactly is the mechanism? So we have to understand there are some weight independent factors also, and there are some weight dependent factors.